Your sugar is normal, but what if you're already insulin resistant? That's the part most people, and even many doctors, miss. Conventional diabetic markers like fasting glucose and HbA1c only rise when it's already late in the game. But insulin resistance can silently build for years before those numbers ever change. This silent disruptor, insulin resistance, begins when your cells stop responding properly to insulin. Your body tries to compensate by pumping out more and more insulin just to keep blood sugar normal. So yes, your glucose may look fine, but your insulin could already be dangerously high. That's why we say, don't just check sugar, check insulin. A simple fasting insulin test tells you a lot. The optimal range is 2 to 6 micro-IU per milliliter. A borderline level is 7 to 9, and anything 10 or above is a red flag, a sign of hidden insulin resistance. You can also calculate HOMA-IR, which stands for Homeostatic Model Assessment of Insulin Resistance. It's done using a simple formula: fasting insulin multiplied by fasting glucose, divided by 405. A value below 1.5 means you're insulin sensitive, 1.5 to 2.5 suggests early resistance, and anything above 2.5 confirms significant insulin resistance. Why does this matter? Because even with normal sugar, high insulin increases the risk of heart disease, stroke, cognitive decline, belly fat, fatty liver, PCOS, fertility issues, inflammation, and full-blown metabolic syndrome. On the outside, you may look totally normal. Your labs say, normal fasting glucose, normal HbA1c. But inside, insulin is silently rising, and routine blood tests may miss this early damage. The consequences are real and preventable. So, how can you reverse insulin resistance naturally? Start your day with 20 to 30 grams of protein, add more fiber from vegetables, legumes, and seeds, cut refined carbs and sugar, avoid frequent snacking, and try early dinners or time-restricted eating. Then layer in lifestyle actions. Walk after meals for 10 to 15 minutes, strength train 2 to 3 times per week, prioritize quality sleep, at least 7 to 8 hours, and manage stress through deep breathing, sunlight exposure, or any calming activity you enjoy. When you make these small changes, the difference is big, and it happens long before diabetes ever begins. These are the insights most checkups miss, but they could save your heart. Don't wait. Prevention is powerful. Follow Preventive Cardiologist for more such evidence-based updates.